Thank you for watching Studio 7 from the Permian Basin Chevy dealers.
So let's get started this week with a look at achieving a beautiful smile. In this week's Ageless Beauty by Dr. Rutherford, the doctor is here and he is our guest today talking about beautifying your teeth. Dr. Rutherford, you have taken us on quite a journey about all the ways that you can make a smile prettier. So walk us through what we've learned so far.
Okay, first of all, we talked about whitening your teeth. The second thing we talked about was the gums, so that we can actually sculpt the gums back up to where they should be instead of down over the tooth. Last month then we talked about gaps. If you have spaces between your front teeth or in your smile, if you're missing a tooth, how we can replace that, like with an implant or with a bridge. Today I wanted to show you a couple of more tools in my toolbox, you might say. First of all, talking about braces.
Okay.
Now, braces do not have to take, 2 or 3 years if you just want to do certain things.
Which is what we think of because our kids usually have them for 2 or 3 years, but that's what you do in the teen years.
Right. Well, and I'm a very unusual general dentist because I do so many different things, but braces is something that I've always done as well. But in this case, it's not going to be 2 or 3 years.
Okay.
Just to show you, here's the first photo. Here's a tooth that just like everything else looks really pretty, but this tooth in particular isn't straight. Well, and it's not broken, it just needs to be moved
so
down
this
so it's straight.
person just didn't love that this tooth seemed a little out of place.
Right.
Okay.
Yeah, everything else was super. So on the next photo it shows, okay, here we put braces on, and it shows what the clear brackets look like. The clear brackets, the bracket is like a handle on your suitcase. It would be pretty hard to hold the suitcase if you didn't have a handle on it, or if the handle broke off. Well, the little brackets glue on, they stick on the front of each tooth, and the wire can even be white coated if you want to, so it can be pretty not noticeable.
Right.
You said you had a friend that...
My best friend did this, and most of the time I didn't even see them. They don't jump out at you.
Yeah,
this is great for
braces
adults.
don't have to be very noticeable nowadays. But the way orthodontics works, braces, is that the wire is flexible.
Okay.
It's flexible and it would like to be straight. And so it just flexes up to that one tooth that's out of line and then back down to all the other brackets. So it kind of exerts a little slow, gentle pressure downwards, and it moves that tooth downwards. The way orthodontics works is that a light pressure over time moves teeth. It just kind of floats the tooth through the bone. So it's really pretty cool.
And the end result here is perfect. And you said this happens in such a short, I'm shocked at how quickly this can happen.
Yeah, not 2 or 3 years. This was like 3 or 4 months.
Wow.
And that's typical for doing something small like this.
And I'm sure this patient, that's exactly what he or she wanted.
Yeah. Now, again and again, I have people tell me that's just as common. They say, oh, my lower front teeth used to be so straight. Everything else is good. And they've gotten crowded. Maybe this is somebody in their 40s or 50-ish or whatever, and they just say, oh, they used to be pretty. So what can you do? Well, no, we don't have to do braces for 2 or 3 years. We don't have to do the whole shebang on all your teeth. We can do braces just on these bottom front few teeth.
Just where your problem area is.
And again, 3 or 4 months.
That's
and they can be perfect.
Okay, so let's say you also have another scenario where maybe you have a slight imperfection. You have another technique that you can use that you say can help a lot of people.
Yeah. Yeah, and this last before and after I think is really amazing.
Let's take a look at this.
If you have just chipped teeth, they're kind of worn, they're kind of chipped for whatever reason. If you look at this photo, you go, wow, that doesn't look as good. Her teeth just don't look nice.
Yeah.
Well, I can just reshape them, just smooth them off a little bit. If you have enough length of the tooth to work with where you can afford to shorten it just barely. Now, if you don't have enough length, I would not shorten these teeth too much and they would look bad. I would say we need to do veneers.
Because part of the art of what you do is helping you find the right proportion. So if your teeth are too short, it wouldn't be an option. But that's gorgeous.
That's right. And so that's the value of experience and having multiple tools in my toolbox that I can do whatever really is appropriate. If you fix the wrong problem, you have fixed the wrong problem.
Yeah.
If you fix the right diagnosis. So in this case, it just needed to be smoothed off, and that's what we did.
And I think this must be very common. I mean, whether we're chewing on a piece of ice or a pen cap or whatever, chips and jagged edges are probably pretty common.
Yeah, or even if you don't do anything wrong, sometimes you can just, chip a tooth,
Get that corner
just needs to be polished off a little bit and smooth.
I did not know this was possible. Orthodontics for your area in such a short time, and even just gently smoothing those teeth out makes a huge difference.
Yeah, and this is actually a lot of fun to me. This takes like 5 minutes. It's not sensitive at all.
Okay.
I asked the person, okay, so is that being sensitive? And they go, no, it's just me kind of smoothing on them, you know. And then they look up in the mirror and they're going, wow.
Yeah, a
So
huge
it's
difference.
pretty cool.
And then all of a sudden they're smiling all the time.
Yeah.
I love it.
Yeah, I didn't even charge for this one. I just thought this is fun and she'll appreciate it.
And look how
it's
pretty
like,
she
wow,
looks.
you know. So
This is cool stuff. Thank you for being with
Yeah.
us today. We appreciate you.
yeah, I love what I do.